Today we're going to discuss the role of progesterone in the etiology of diseases affecting the female. We will start with an understanding of what progesterone is and how important it is in maintaining the health of a developing female. Progesterone is produced by the corpus luteum, which is the remnant of the ovulatory cycle where a woman produces an egg. Progesterone is produced usually day 12, 13 of the cycle, where day 1 is the first day of bleeding, and usually lasts 12 to 14 days until the cessation of progesterone production induces what we call a menstrual cycle. In this production of progesterone, it becomes integrally important in many disease processes if there is a deficiency of progesterone or there is an abnormal ratio between estrogen and progesterone. So let's start with a woman who is 12 years old, is beginning to menstruate, and her menstrual cramps are severe. She has irregular cycles, and she's bleeding heavily. That's the time when most of these patients are perfectly normal, but they're not producing a corpus luteum, but they are producing a lot of estrogen. So they're estrogen dominant, they produce a lot of tissue that ends up with a heavy cycle, and progesterone is not being produced, so the cycles are very irregular, and a lot of cramps develop because the blood has to be squeezed out of the uterus, and therefore we call that secondary dysmenorrhea or primary dysmenorrhea if indeed we don't know what the etiology is. That's very important for young women because it can really affect your schoolwork, it can affect how you relate to people because it's not a very happy time when you're having such severe cramps. So that is the age group, usually between 12 and 15. By 15 or 16, a woman will tend to become regular and produce ovulatory cycles, which obviously means that she can be impregnated. So when we deal with birth control pills about in that period of time, 16 to 19, that stops the ovulatory cycle. Again, will produce no progesterone because the ovulatory cycle is cut off, and that leads to certain problems that we see in young women, mainly that they become very moody, they can become very irrational. Their progestins, which is not progesterone in the birth control pill, have other side effects that are not very pleasurable. Therefore, we tend not to use as much birth control pill as we used to because we know now that progestins, which is synthetic progesterone, does not do well with women. Then you enter the phase between 21 and 30 where fertility becomes a very important issue. In my experience, after doing this for so many years, I find that patients who had dysmenorrhea or irregular periods when they were very young will also develop problems with obesity, weight gain, and we kind of categorize all of these ovulatory dysfunctions as polycystic ovarian disease, which means their periods become irregular again, they start gaining weight, they have some hirsutism, which is abnormal hair growth in certain areas, and when we do an ultrasound, we find that the ovaries have been replaced with excessive amounts of tiny follicles. Unfortunately, these follicles and the ovary covering that covers the ovary at that particular time will produce a lot of what's called androstenedione. Androstenedione is an androgen, it's a male hormone, which also feedbacks and cuts off the chance of ovulatory cycles. So a lot of these patients become infertile or become difficulty in getting pregnant. Polycystic ovarian disease is a combination of many enzymatic deficiencies in the ovaries, and yet can be, again, a result of basically an estrogen dominant state and androgen dominant state, but a deficiency of progesterone. These patients do very well putting on birth control pills because at least that cuts off the stream of androstenedione, which produces the hirsutism, the acne, the weight gain, and that usually is very helpful in that stage of life for not only the obvious value of looking better without acne, but also the weight gain issue. So in that case, a lot of times we find success with that. However, I always add a natural progesterone product to help this woman go through that process, so at least she has the advantages of progesterone that we'll discuss in a few minutes. So once you go into the 28 to 35 range, another disease process begins to pop up and peaks, and that is something called endometriosis. Endometriosis is when the tiny bits of tissue develop in the lining of the peritoneal cavity, called the peritoneum, and it covers basically all the organs inside your abdomen. And that begins to transition from a neutral cell to an endometrial cell. The endometrial cell then, with each cycle, will begin to bleed internally and cause pain and scarification. It can also develop as forming chocolate cysts of the ovaries, called endometriomas, which is a result, again, of the abnormal amount of estrogen and usually deficiency of progesterone. If it's caught early, it is very easily treated by balancing off the hormones with predominantly progesterone therapy, and also very important to realize that surgery does not cure endometriosis. It only treats the symptom, whatever it is. Laser surgery used to be done very often with these patients every 2 to 3 months sometimes, because it comes right back if the hormones are not dealt with. So if you're suffering from that and the doctor's recommending surgery, maybe that's necessary, but then what? The then what will be to replace the progesterone, balance out your hormones so it doesn't continue to recur month after month after month. So now we're talking about a woman 30s, upper 30s, and all of a sudden we have a syndrome that we call PMS. PMS, premenstrual syndrome, is a condition whereby as progesterone drops premenstrually, the sudden drop of progesterone causes a woman to have all sorts of symptoms. A lot of them are emotional. It's not psychological illness that's the problem. It is actually hormonal. And the main factor when I see someone with severe PMS is to replace her progesterone level into the first few days of her cycle to basically counteract the effects of that sudden drop of progesterone that some women are extremely sensitive to. Then you deal with a woman now who's 40, 45. I don't like the word perimenopause, but I see so many patients who say, I have perimenopause. The word menopause means a stoppage of cycles, usually 1 year. However, that's before we had clinical diagnosis of hormone deficiencies, which we can easily get by blood testing checked in the second half of the cycle, which happens to be called the luteal phase. So many patients are deficient. They stop ovulating on a regular basis, similar to what happened when they were pubescent. So we go ahead and we treat very similarly. We try to balance their hormones, give them mainly progesterone, and we try to counteract the effects of what we call estrogen dominance. Unfortunately, in that period of your life, your metabolism is also changing, your dietary habits may not be the best, and it begins to catch up on you, and the main symptom we find is excessive weight gain. We have an excellent weight management program that we utilize to help you with that, but the main thing is to get your hormones squared away before you enter the final stage, which is a cessation of hormone production by the ovary. And now we use the word menopause or postmenopause for that. However, again, it's the clinical manifestation of deficiency of hormones that we can evaluate. We can get blood testing for that. We can confirm what they are exactly and can replace down to the millimeter. So what I try to do is understand where a woman is at in her phase. But what fascinates me, which is the purpose of this video, is that through an entire lifespan of a young female, at every stage, there are manifestations of hormone deficiencies, hormone dysfunction, progesterone deficiency mainly, or estrogen dominance. So I've given you some sections and some disease diagnoses, but if you put it all together, it can start at 12 and it can end at 50. And what we see throughout the entire woman's life is the failure of most doctors to understand how it is all connected. And those of you listening can probably relate to someone you know or even yourself that this was missed time and time again. And therefore, what I'm hoping you do is you begin to research further and understand how all of this culminates in what we call menopause or complete hormone deficiencies, but has a lot of precursor symptoms, have a lot of precursor diagnoses that is missed by most practitioners. Have a great day, and thank you.